Alright, before going in the patient's room, I would review her chart for code status, which she is a DNR, and allergies. She has no known allergies. I would gather my supplies, which for a physical assessment is my pen light, stethoscope, and gloves, but usually the gloves are in the patient's room. Alright, so then I'm going to the patient's room. Hey, Miss Jones, I'm Kim. I'm the student nurse. I'm going to be performing a physical assessment on you. Is that okay?
Yes, ma'am.
Okay. So at that point, I would wash my hands, don my gloves. Can you state your name and date of birth? And I'm going to look at your wristband to make sure.
Mary Jones, January 17, 2007.
Okay, so she is who she says she is, and I checked her wristband. I'm going to be performing a physical assessment. You shouldn't cause any pain or any discomfort during the whole thing, but if it does, just let me know, and I'll just be assessing your joints, range of motion, and assessing your skin from head to toe and anything. Make sure everything's normal and nothing abnormal. Okay, so if you do experience any pain, you just let me know. Alright, so then I'm going to provide privacy. I'm going to raise the bed up, and I'm going to make sure she's comfortable and put her in a comfortable position. Okay, and then I would begin my assessment. I reviewed your chart before coming in, and all your vital signs was within normal limits. Blood pressure was good, pulse was good, respirations was good, temperature. And do you have any allergies?
No, ma'am.
And what's your height and weight?
5'2" and 104.
Okay. And you have no allergies. Can you tell me where you are? The question. Can you tell me where you are and why you're here?
I'm here for an assessment and at the hospital.
Okay. So at that time, I would assess her speech, which is clear, the tone, volume of it, clarity, and make sure she wasn't slumping. I would assess her hygiene at that time, which she's clean, upkept. Her posture, she's not leaning, she's sitting straight up. And then I will explain what I'm going to do. The physical assessment, I'm just going to assess you from head to toe. This shouldn't cause any pain or discomfort, and if it does, let me know, okay? And you have no allergies, right? And no pain. Okay. Alright, so provide privacy. Then I'm going to start with her head. Okay? So I would feel all around the head for size, shape, and symmetrical. And I could assess her scalp, which is not dry, flaking. Hair distribution, which is even throughout, it's not thinning. Texture, it's not dry, breaking off. Then I would go on to her face. Her face, the skin is normal, it's not dry, cracking, breaking off, or flaking off. It's symmetrical. Alright, now I'm going to be doing assessing your face muscles, and I'm going to be making some faces, and you can just repeat them after me, okay? Alright, so squeeze your eyes real tight. Okay, so her eyes are symmetrical. Alright, so now frown. Her mouth is symmetrical. It's not drooping on one side, neither is her eye. I could assess her eyebrows and eyelashes, which they're evenly distributed, the hair. Now I'm going to have you to smile where I can see your teeth and gums, and I would assess then for her gums to make sure they were the color of them and there was no bleeding. I could assess her teeth at that point for cavities, dentures, or any of that. And she doesn't have anything like that. Alright, so I'm going to have you to raise your eyebrows. And that's normal. Just everything's symmetrical on the face. Alright, so then I would assess her eyes. Alright, so I would dim the lights. Okay. Alright, so what I'm going to do, I'm going to be shining the light in your eyes, okay? And you just let me know. You're still doing okay? Right? Okay. So I've already dimmed the lights. I would come in from the side. Okay. Okay. At that point I could assess the sclera, which is clear, the pupil size, which is normal, and then I'm going to check the accommodation. So look at my pen light, and then look over my shoulder, and then look over my shoulder, and then look back at it. Okay, so the accommodation is good. Now we're going to check the convergence. Alright, so follow the light as I go towards your face, okay? Okay, and convergence is normal. Her eyes cross or come together as I go closer. So when her eyes, since they're normal, is perla, which is pupils are equal, round, reactive to light, and accommodation. Alright, and also she has no drainage, glasses, or anything like that coming from the eye. Alright, at this point I could check her, I would assess her nose. Her nostrils, they're not flaring. Could check the outside of the skin, which is not flaking or peeling or anything. Then I would take my pen light, I would shine up one nostril. I don't see any lesions, redness, or drainage. The other side, no lesions, drainage, or growth or anything. And I also would check the septum, which is there and in line. Alright, so then I'm going to check the patency of her nose. So I'm going to have you to press one nostril and then take a breath in on the other. Okay, and then on the other side, press the other nostril. Okay, so the patency is normal. Alright, so then I would move on to her mouth. I would inspect her lips, which they're not dry, cracked, they're moist pink. I would have her to open her mouth. I would inspect the inside for any redness, swelling. At that point I could check the hard and soft palate for the color. And then I could assess her tongue, which is pink and moist. I could also assess her gums to make sure there was no bleeding and ask her about, you don't have dentures. At that point I could tell, and if she did, I would take them out. That's normal. Her tongue, pink, moist. Hard and soft palate. The texture and the shape. Okay. And then, alright. Her teeth was good, no cavities, chipping. Gums were good. Alright. Alright, so now I'm going to move on to her ears. So on her ears, I would take my pen light, shine on the outside to make sure there was no flaking or discharge, and there's not. Her skin's intact and moist. And then I would take my pen light and shine inner light to make sure there was no drainage or serum impaction, and there's not, or no buildup Also, I would assess for hearing aids. She doesn't wear hearing aids. And I will do the other side. The skin's not flaking or anything on the outside. There's no lesions. And also in her mouth, I would check and make sure there was no lesions or anything. Her mouth is wet. Peel out, there's no drainage or impaction of serum. No hearing aids. Do you have trouble hearing? And I would ask about hearing, and she seems to hear fine. Alright, so then I would move down to her neck. I would feel and make sure there was no swelling, the adenoids. So she's good there. The neck, I would check the trachea is in line. Alright, so then I would start with the cardiopulmonary. I would first feel, or lightly feel, across for anterior for any masses or tenderness. And that's good. Now we'll do the same on the back. I will feel for any masses or tenderness. Okay. Alright, and then I would also assess the chest, inspect it. I would watch the chest rise and fall, make sure it's equal, symmetrical. I don't see any lesions. It rises and falls. Alright, and I can also feel and make sure it rises and falls. Now, so, same on the back. Okay. Alright, so then I'm going to listen to the heart sounds. Alright, so I would start with the aorta. The aortic. Pulmonic. Tricuspid. And then the mitral, which is also the apical pulse, and I would listen to for 1 full minute. Okay. And when listening to the heart sounds, the S1 is the lub, and then the S2 will be the dub sound. So now I'm going to, and I would listen to each heart sound for 10 to 15 seconds. Alright, so now I'm going to listen to the breath sounds. 6 anterior. 1, 2, 3, 4, 5, 6. Alright, and then we'll go to the back. 1, there's 8 posterior. 1, 2, 3, 4, 5, 6, 7, 8. Okay, and 2 on the side. You raise your arm up a little bit. 1, 2. Okay. And then 2 on the other side. 1, 2. Okay. And I would listen for a full breath, inhale and exhale in each spot. Also, the breath sounds, I'll listen to that, inhale and exhale, and if I couldn't hear, I would have the patient to take a long deep breath, slow deep breath. Alright, you okay? Okay. So then I would move on to the bowel sounds. I would inspect the bowel, or not the bowel, the abdominal, in all 4 quadrants to make sure there was no lesions, masses, or swelling or anything like that. Then I would auscultate in all 4 quadrants, each quadrant for 10 to 20 seconds. 1, 2, 3, 4. Okay. Her bowel sounds are normal, which is hyperactive. And then I would lightly palpate all 4 quadrants. 2, 3, 4, and I'd be feeling for masses, tenderness, or anything like that. And then I would lightly palpate over the bladder for distension. Okay, and there's no distension. Alright, so then we're going to move on to the perineal area. I would assess the perineal area for any kind of lesions, discharge, drainage. And I also would inspect the rectum for the same, any lesions, hemorrhoids, anything like that. Then I'm going to go back to my pulses. I would check the carotid, but check them one at a time. You can't check them both at the same time. So I'd have her to tilt her head just a little bit towards the side I was checking. Okay, then the other side, and lean your head towards, just a little bit towards the side. Okay, and that's normal. Then I will go down to the radial pulse. Alright, so with the radial pulse I could check, or I would want to check both of them at the same time to make sure they were equal. Okay, and then I will go to the brachial pulse. Okay, then I will go down to the femoral pulse, which is right here in the groin area. Okay, alright, then I will check the popliteal pulse. Okay, and then the pedal pulse, which is the other pulse that I could assess both sides at the same time. Okay, and then the posterior tibialis. Okay. Alright, so I could label the pulses as +1, which is weak and thready, +2, which is normal, which hers was a +2, or a +3, which is bounding. Alright, so then I'm going to go and inspect her skin. I would look for lesions, any lesions, bruising. I would assess the color. And I would also look at her feet too. I would assess the skin turgor, or the turgor, which is the tinning. Most people, or except elderly, pinch the top of the skin or the arm and make sure there's no tinning. Alright, and then I could feel, let me see her hands. The skin, I would also, when checking the color, I would check the temperature of it. So feel it. Okay, and it's warm, and her skin's moist, and the same. There was no bruising. She has no ostomies or anything anywhere. Alright, so then I'm going to assess the musculoskeletal, which is her, I'm going to check the muscles in her neck and shoulders. Alright, so I'm going to have you to lean against my hand. Push against my hand. There you go. Okay? Now push that way. Push against your whole head. There you go. Alright, then I would have her to shrug your shoulders. Like push your shoulders against my hand. Okay? That's normal. Alright, and then her feet. Alright, push my hands like you're pushing a gas pedal. Okay. Hold them up like toes towards your nose. Okay. So her strength is equal and bilateral on both sides. I could also check for edema, which would be, I would press, and edema can be 1 to 4. She has no edema. 4 being like you can mash it and it won't go back, but she's normal. Then I would go on to her checking her strength in both hands. Alright, I'm gonna have you just squeeze my hands, okay? Alright, so her strength is equal and bilateral on both sides. Alright, so then we're going to be doing a little bit of exercises. At this point, I could assess her extremities in her limbs for any abnormalities or deformities, and she has none. Alright, so I'm going to have you to first assess your elbows, okay? No, let's do your arms. Alright, so I will lower the bed, because I'm going to have her to get out of it in just a minute. But while she's there, I'm going to go ahead and inspect her spine. I'm going to have her to bend over. Alright, so her spine's in line, no curvature or deviation. Okay? And I'm going to have you to stand. So I lower the bed, I'm going to help her out. Alright, so now we're going to do the range of motion for your neck. Just do what I do, okay? Forward, back, side, side. Okay, so she has no limited range of motion. I'm going to check your arms. Just stand right here, facing me, and just do the exercise I do, okay? Up, down, out, down, around. Okay, so that's normal. She doesn't have any limited mobility there. Then I would assess her hips. So I would have her, let's go ahead and assess your spine again. Let's go down, up, over, back, forward. And she has no limitations there. Then I would check, we're going to go on down to the hips now. So I would have you, alright, so just do everything I do after me, or do it with me. Hip up, back, around town, out, over, and then back. Alright. Then the other one, the same way. Up, back, around town, out, over. Okay. Now we're going to do your legs, your knees. Alright, so bend up, out, and back. Let's do the same for the other one. Up, out, in front of you, and back. Okay. Alright, so then we're going to move on to her ankles. Do your leg, foot. Yeah, get on your heel like that. Then go out, in, up, down, and I'm going to go ahead and assess her toes. I'm going to have you to curl your toes down, take them back to normal, and spread them apart, and put them back. Okay. Now with this one, you want to assess the ankle because we did a knee, right? Yeah, I've already assessed her knee on that one. So we're going to do the ankle now. So like that, out, in, up, like a gas, press down like a gas pedal, then pull up. Curl your toes, back to normal, spread them out, back to normal. Okay. Alright, so now let's do your, we're going to assess your elbows. Alright. So, this, like that, over. Okay. Now let's assess your wrist. Make a fist. Or you can go, girl. Just make a fist. Relax. In. Out. Okay. And then your fingers, take your fingers and back as far as you can. Okay. And spread them apart. Back together. Okay. So she has no limitations there. So her fingers, she has no limitations there. As far as her feet, we did your toes. She curled them down up, so out. Alright, so now let's do your fingers. I'm gonna have you back to your fingers. She went, do your fingers in, out, in. Alright, so now flip them over. And I'm gonna have you to touch your thumb to your pinky and then go through each one of your fingers. Okay, so she has no limitations there as well. Alright, so then we're gonna go to her, we did the legs, the knees, the feet, the toes. She curled the toes up, down. You did all that. Okay. So now I'm going to assess her gait. So I'm going to have her to walk 5 steps forward and then 5 steps back to me. Alright. First I would ask her, do you walk with any assistive devices?
Yeah, ma'am.
So she doesn't need a walker or cane or anything like that. So now you walk 5 steps towards the door. Then 5 back. And I would assess her gait. She's steady. She's not shuffling. Her gait, she is normal. Alright, then I would help her back to bed. Alright, so when I was checking the extremities or circulation, I should have at that time checked for peripheral refill. So what I would do is mash, make sure that capillary refill isn't greater than 3 seconds, and I would do it on each side. And it's not. Getting her toes. Okay. Also, I would assess her fingernails for color, texture, and shape. And her fingernails are normal, round, normal color. Okay. So, is there anything else I can help you with, Miss Jones? Her gait was normal. She has no limited range of motion. I'm going to have her back to bed. I'm going to get her comfortable. Bed in lowest position. Give her her collar light. Is there anything else I can help you with?
No, ma'am.
Okay, so then I would remove privacy. Take off my gloves. Wash my hands. Go out and document. That's it.